Hello, everyone, and welcome to Living Diabetes. In this episode, we're going to discuss continuous glucose monitors, or as you probably know them, CGM. You've probably heard about them. They're making quite a splash in diabetes care, and for good reason. They offer a whole new way to understand your blood sugar. Now you might be thinking, don't we already have finger stick tests? And you'd be right. But here's the thing, finger sticks only give you a snapshot of your blood sugar at that specific moment. It's like trying to understand a movie by only looking at a single frame. CGM, on the other hand, are like watching the entire movie, giving you a continuous stream of data all day and all night. This constant stream of information is proving to be incredibly valuable for people with diabetes and the doctors who treat them. We're seeing a real shift in how diabetes is managed thanks to these devices. For starter, CGM has been shown to significantly improve how well people manage their glucose levels. Now that might seem obvious, right? More information should lead to better control. With traditional finger sticks, it's easy to miss those subtle ups and downs in blood sugar that happen throughout the day and night. But with the CGM, you see those patterns, those trends, and that's where the real magic happens. Doctors are finding that this continuous data allows them to make much more precise adjustments to treatment plans, whether that's fine tuning insulin doses or helping someone make lifestyle changes. It's like having a personalized roadmap for managing your diabetes. And speaking of personalized care, there's a new buzzword in the diabetes world that's gaining a lot of traction: time in range. It's a simple concept, but it has profound implications. Time in range refers to the percentage of time your blood sugar stays within a healthy range, typically between 70 and 180 milligram per deciliter. Now, this might sound like just another number, but it's actually becoming an incredibly important measure of how well you're managing your diabetes. Some experts even believe it's surpassing the traditional HbA1c test in importance. Why? Because time and range gives you and your doctor a much clearer picture of what's actually happening with your blood sugar throughout the day. It's more actionable, more specific, and ultimately more empowering. And here's where it gets even more interesting. This time and range data isn't just useful for manual adjustments. It's also the key ingredient for the next generation of diabetes technology: automated insulin delivery systems. These systems, sometimes called aid systems, are like having a mini pancreas working for you 24/7. They use the continuous data from your CGM to automatically adjust the amount of insulin your pump delivers, aiming to keep your blood sugar within that target range as much as possible. The results from studies on these aid systems are quite impressive. We're seeing improvements in time and range, fewer of those sleep interruptions caused by high or low blood sugars, and even help with something called the dawn phenomena, those early morning blood sugar spikes that can really throw off your day. It's really remarkable to think about how far we've come in diabetes care. From those simple finger sticks to these sophisticated devices that are almost like having a co-pilot for managing your diabetes, it's an exciting time to be following these advancements. And the innovation doesn't stop there. New CGMs are becoming available without a prescription, opening up access for even more people. One example is Dexcom Stelo, designed specifically for people with type 2 diabetes who don't use insulin. It's worn on the arm for up to 15 days and sends all the data straight to your smartphone. This shift towards wider accessibility is a huge step forward. The more people who have access to these tools, the more we can empower individuals to take control of their health and work towards better outcomes. Now you might be wondering, with all this talk about CGMs, what about those automated insulin delivery systems? How do they actually work? Well, the key is in the algorithms. These algorithms are like the brains of the operation, constantly analyzing the stream of data coming from the CGM and making decisions about how much insulin to deliver. It's a bit like having a very sophisticated thermostat for your blood sugar. Instead of simply turning the heat on or off, these algorithms are constantly making micro adjustments, aiming to keep your blood sugar within that healthy range. And the really cool part is that these algorithms are constantly being refined and improved. Researchers are using data from thousands of users to tweak and optimize these systems, making them even more responsive and effective. We're seeing some really fascinating advancements in this area. For example, Medtronic is developing a new algorithm called NMX8. It's designed to be even more proactive, anticipating changes in blood sugar and adjusting insulin delivery accordingly. It even has a feature called Pump Start, which bypasses the typical 48-hour warm-up period for smart guard activation. And get this, NMX8 is even designed to deliver automatic meal boluses without you having to input any information. It sounds like something out of a sci-fi movie. But it's becoming a reality, and it's not just Medtronic. Tandem is also hard at work on a new algorithm called Freedom. Their goal is nothing short of a fully closed loop system, one that handles all aspects of insulin delivery without any input from the user. Imagine that, not having to think about policing for meals or correcting high blood sugars. That's the ultimate dream for many people with diabetes, and these advancements are bringing us closer to that reality every day. The future of CGM and aid technology is bright, with ongoing research and development pushing the boundaries of what's possible. We're seeing longer sensor wear times, improved algorithms, and smaller, more discrete devices. But it's not just about the technology itself. It's about access, ensuring that everyone who could benefit from these tools, there's a real need for greater awareness, better insurance coverage, and ongoing support for both patients and healthcare providers. There's a fantastic example of what's possible when we get it right, like in Sweden. They've embraced CGM technology and made it widely available, along with comprehensive education for healthcare professionals. The results are pretty remarkable. Children HbA1c of 6.9%, a level of control that was once thought to be unattainable for many. It just goes to show the potential of these technologies to transform diabetes care when we prioritize access and education. Continuous glucose monitors are truly changing the game for people with diabetes. They're not just providing data, they're providing insights, empowerment, and a path towards better health. And as these technologies continue to evolve, the future of diabetes management is looking brighter than ever. So we've talked about the present and the exciting future of CGMS, but the story doesn't end there. There's so much more happening on the horizon, and it all points to an even brighter future for diabetes care. One of the most promising areas of development is expanding the use of CGM to populations who haven't traditionally had access to this technology, like younger children, pregnant women, and people with type 2 diabetes who don't use insulin. For example, Medtronic is currently conducting studies to evaluate the use of their MiniMed 780G system in preschoolers as young as 2 years old. They've already submitted their findings to the European Union for approval. There is a plan to submit to the FDA in the US in early 2025, and it's not just Medtronic. Tandem is also running a trial to assess the use of their control IQ system in pregnant women. Managing diabetes during pregnancy can be particularly challenging, so having access to real-time CGM data could make a huge difference for both the mother and the baby. Then there's the increasing availability of over-the-counter CGM like Dexcom Stelo, which we discussed earlier. This is a game changer for people with type 2 diabetes who don't use insulin. It gives them access to the same valuable insights into their blood sugar patterns without needing a prescription. The push to make CGM technology accessible to a wider range of people is incredibly encouraging. The more people who have access to these tools, the more we can empower individuals to take control of their health and work towards better outcomes. But it's not just about extending access. It's also about continuing to refine and improve the technology itself. Companies are constantly working on new sensor technologies and algorithms to make CGM even more accurate, reliable, and user-friendly. For example, Medtronic is developing a next-generation CGM that they claim will be even more accurate than their current models and have a longer wear time. And Dexcom is also hard at work on a new sensor that they say will minimize interference from the acetaminophen. We can expect to see even more sophisticated and reliable CGM hitting the market in the coming years. And of course, there's the ongoing quest for that fully closed loop system, the holy grail of automated insulin delivery. Both Tandem and Insulet are working on algorithms that would essentially mimic the function of a healthy pancreas, automatically adjusting insulin delivery based on CGM data without any input from the user. Imagine a world where you don't have to constantly think about managing your blood sugar, where technology takes care of it for you. That's the promise of these advancements, and it's closer than ever before. But as with any new technology, there are challenges. Access and affordability are big ones. CGM and aid systems can be expensive and insurance coverage varies widely. There's a real need to advocate for greater access and affordability so that everyone who could benefit from these technologies can have them. Education is also key. Healthcare providers need to be well informed about CGM and aid systems so they can properly educate their patients and help them choose the right system for their needs. And people with diabetes need to be empowered to use these technologies effectively and to understand the data they provide. Despite these challenges, the future of CGM and aid systems is incredibly promising. These technologies are already making a huge difference in the lives of people with diabetes, and they have the potential to truly transform diabetes care in the years to come. Continuous glucose monitors are much more than just data gathering devices. They're tools for empowerment and a path toward better health. And as these technologies continue to evolve, the future of diabetes management is looking brighter than ever. Keep learning, stay informed, and remember knowledge is power, especially when it comes to your health. If you found this episode helpful, please follow, rate, and review the podcast on your preferred platform. Your support helps this content reach more people like you. And if you have questions, comments, or topics you'd like us to cover in future episodes, drop us a message. That brings us to the end of today's episode. I'll see you next time.